All right, here we go. Hello, everyone, and thank you for watching this webinar on how to create a billing and coding policy manual. There's no audio taping or videotaping allowed, and the information in this presentation is for educational purposes. It's not intended to be legal advice. We're not attorneys here at Target Coding. I've made every attempt to make certain the information is 100% accurate. I'll tell you a little bit about myself before we get going. My name is Dr. Marty Kotlar. I'm a chiropractor. I'm the president of Target Coding. I'm also a certified professional compliance officer, a certified billing and coding specialist. And I consider myself kind of unique because most chiropractors are not certified coders. Most certified coders are not chiropractors. So I could take this unique approach to helping chiropractors, challenging them. If they come up with a diagnosis that I don't think sounds right, I can challenge them because of my years of chiropractic experience and then lead it into a proper code to help make sure you're getting paid and make sure you're not leaving money on the table. A lot of people call me the insurance guy. I don't consider myself the insurance guy. I consider myself the compliance guy. I want to make sure you're billing and coding properly. You have all your policies and procedures in place. I want to make sure that you're not, violating any state laws. Um, and we just want to make sure that you're maximizing reimbursement. I've also written many books and training manuals on chiropractic billing, coding, and documentation. I write articles to the major newspapers and magazines that you get, like Chiropractic Economics, Dynamic Chiropractic, The American Chiropractor. I write articles for many state association newsletters and other organizations, and I'm a guest speaker at many state association conferences nationwide. So here we go. I have a question for you. Let's start off with this question. Why have a billing and coding policy manual? That's what we hear. Well, Dr. Kotler, I got a lot of stuff going on. We're so busy. How are we going to find the time? And why do we even need one? Another thing we need to do, right? That's what we hear. Well, here are the reasons. Number one, probably the most important, is for your staff. Your staff members want organization. They want leadership. They want to work in an organized atmosphere. Just ask them. Don't take it. Don't take my word for it. They want to work in an ethical and trustworthy environment. And a coding and billing policy manual creates this culture of compliance. It's an extension of your mission and values. Do you have a mission? Do you have values? I'm assuming you do. Also, if you have a staff member that all of a sudden becomes disgruntled and accuses the business owner of wrongdoing, if you have a policy manual that the staff member read, understood, and signed to follow, then you can defend yourself against any alleged misconduct. How about for the doctor? A billing and coding policy manual is important for the doctor because you can tell everyone, if anybody came snooping around, especially for your staff, what is your policy on collecting deductibles and copays? What's your policy if you do a full spine manipulation, but you only bill 98940? All these things that you do in your practice. The billing and coding policy manual allows you to tell your story in a professional manner. It'll definitely help you SWAN. That's my favorite acronym, sleep well at night. And if you're ever in a audit, a billing and coding policy manual can help mitigate fines and penalties. You look bad and unprofessional if you can't prove to an investigator, a state board, or a patient what your billing and coding policies are and why you do what you do. They must be formal, that means in writing, and kept track in training logs. So there are the reasons why you should do it. Now, it's not overwhelming. You should try and put one together on your own. It's not that difficult. You can go online and read about how to create, take the information from this, and start putting one together on your own. Now, for some offices, it's just overwhelming. It's too much. So we can do the heavy lifting for you. We could put it together for you. But before you hire anyone, try putting it together on your own. But start with these three essentials. Create policies and procedures, perform patient record reviews, and conduct regular staff trainings. These are the three essentials. There are other policies and procedures. In our training manual, we have 19 policies and procedures, but these are the three essentials here. Now, the OIG, the Office of Inspector General, the mission of the OIG is to protect federally funded programs from getting ripped off and abused by healthcare providers. So they want to protect Medicare, Medicaid. These are the federally funded programs, TRICARE. So over the years, there have been some things that the OIG has found to be inappropriate. This is a report that got put out on chiropractic. They don't just pick on us. They do this for all healthcare providers. They review documentation and billing patterns of all providers in the Medicare, Medicaid program. And sometimes the OIG puts out reports. This is a report that got put out. It doesn't look good. The optics of this is not good. Hundreds of millions of Medicare payments for chiropractic did not comply with Medicare requirements. I read this study. I read this report. It was flawed. I think it was a terrible way to evaluate what we do. They just took a few visits and they compared it to millions of other visits, and I really felt that this was an unfair report, but it's out there. So insurance companies and Medicare and other federally funded programs and auto accident carriers, they may think you're not billing and coding properly. So they want providers to be proactive. That means, you know, putting things in writing, having formal staff trainings. It's not a big deal. It's not difficult. On the surface, you might be thinking again, oh boy, another thing we have to do. It's not that difficult and it doesn't take that long. So back to these three essentials: policies, procedures, performing record reviews, regular staff trainings. Let me show you how to put these together. I'm going to give you actual sample policies right out of Target Coding's compliance manual. Here's policy on record reviews. Here we go. Policy, procedure. The policy, the backbone of any compliance plan, is reviewing and monitoring components. Without them, we would not know if we're being successful in our best efforts to be compliant. Therefore, it will be our policy to perform periodic patient record reviews. How often? Well, the reviews will consist of, I typically ran 4, 5, 6 charts every 4 to 6 months. So a couple of times a year, you'll pull charts and you'll go through them. What do you do? What do you do when you go through them? What are you supposed to do? Well, I don't know how many of you have ever tried this. Maybe you've done it with other companies, but this is how we do it. Here at Target Coding, we have a simple spreadsheet. And you take out a note and you put it next to the spreadsheet. So here's the note, here's the spreadsheet. And then you start asking yourself some questions. Is the patient's name and date? You know, some simple stuff there. Is the patient's name and date on this note? Yes or no? You click yes. Are the subjective symptoms listed? Yes or no? Did the doctor sign the note? Yes or no? Are the areas of subluxation noted? Yes or no? Is the amount of time for each time-based code listed in the note? Yes or no? And then you score yourself. We have an example scoring method there at the bottom. Next policy is on training. Many of you have trainings with your staff, right, doctors? You meet with your staff all the time. I have some doctors I work with. They have they call it a team huddle before every shift. In the morning, they have a little team huddle, and then before the afternoon shift, another team huddle. Yeah, I have doctors I work with. They have, 1, 2 meetings every day with staff. So now, do you write that down? It's a good idea to be able to prove it. Prove that you have staff trainings. If you just verbally say, yeah, we have staff meetings, verbal doesn't really get you too far in the world of compliance. You've heard this before. If it ain't written down, it didn't happen. You could say you have staff meetings all the time, but if you don't write down that you have them, yeah, it's hard to prove. So here's a policy. We're going to train our staff 3 hours per year on proper billing and coding. There's the policy and procedure. So how do you prove it? Put together a simple spreadsheet. We have an Excel spreadsheet, listed persons that attended the meeting, the date, the topic, the length. If you attend a CE seminar, add it to this. Let's say you send your staff to a billing and coding seminar, add this to the employee training log. Keep track of all the items. You have a CA or doctors, you go online. Even if you go and watch a YouTube video on, proper billing and coding, add it. Now, of course, that's a little bit of the honor system there. You could write down, I watch 50 videos on YouTube, but make sure that some or most of these can be contested, so you have something in writing to prove. Even if you go to a non-CE seminar on billing and coding, get a certificate of attendance. That's what we do all the time. We give out certificates of attendance to our seminars. Even this webinar, we can send you a certificate of attendance so you could put it in your training manual. Do you do background checks? Are you required to do background checks? What's the deal with that? You're sending out bills to federally funded programs, Aetna, Cigna. Who's sending out these bills? You want to verify that the staff person is not going to cause any issues. You could do a background check, but sometimes it's even with a background check, it's difficult. So, have a brand new staff member, we recommend contact the references, check social media pages. You want to do a criminal background check? We're working with a doctor right now, staff member, she changed her name. She was stealing checks. She was stealing from the doctor. It was difficult to track even with the background checks, but try your best, contact resources. Now, as far as Medicare exclusion list, this is if you see Medicare patients, doctors, and any staff member, yes, even the staff member's name need to go in this exclusion list to see if the person's been excluded from the Medicare program. So here's our policy. In an effort to curb fraud and abuse, the OIG requires exclusion list checks. So procedure, we will perform background checks and check with the OIG exclusion list. There's the website, exclusions.oig.hhs.gov. If you do not see Medicare patients or any federally funded patients, you don't have to do this. But most of you listening to this, I would say 95% of you listening to this, see Medicare patients. Put your name in, print it out, that your name does not appear, you're not excluded. Staff members, if you have a CA that is billing out your Medicare claims, put his or her name in here. If you use a billing company, put the owner of the billing company in here. Anybody that you associate with that has anything to do with billing and coding in your office, put their name in this website. Let's say you wanted to hire Douglas Godfrey to work for you. His name comes up. You would not be able to allow Douglas to have anything to do with your federally funded patients. He's been excluded from the program. Be careful, there are fines and penalties. Here's a chiropractic office that had to settle a case because the individual was seeing patients but was excluded from the program, $7,000 fine. Oh, this is an actual page out of Target Coding's policy and procedure manual. These are the policies. Most of them you just have to read and understand. A few of them you need to take action. So here's a few questions. What's your policy on collecting deductibles, copays, and coinsurance? You should have one. Just a little background for those of you that are new to billing. A deductible is the amount paid by the patient prior to the insurance kicking in. Coinsurance is a percentage that typically applies to out-of-network providers. A copay is usually a flat fee, and that applies to in-network providers. Routine waiver of copays and coinsurance is inappropriate. The key word is routine. So that means if you don't do it routinely, it could be okay. Yes, it's okay. I had a patient come in. I waived her copay, her deductible. I gave her actually free care. It was a case-by-case basis. This is a woman that, she lost her job. She's going through a lot of stress. She's a single parent. Mentioned to me that she has some, financial hardship. Yeah, I gave her free care. Some patients I waived deductibles. It was done sparingly. If you do it routine, you're going to have problems. You'll probably have problems, maybe not. I don't know if you're a gambler. This doctor had a problem. He got caught, but he got lucky because Medicare said, we're just going to educate you and inform you that we received a complaint that you knowingly process claims as if their patients are paying their co-payments, but they're not. So they just made them, they just gave them a little warning, a little slap on the wrist. But this doctor, no, this doctor got a letter from Cigna saying, we want to see copies of your patient billing. I don't know if you guys could see this, the third bullet down. This is a doctor that got a letter from Cigna. Cigna said, we want to see copies of the patient billing and collection ledgers. We want to see documents that show when bills were sent to the patient, if any, and how much money has been paid by the patient, if any. This is a problem for this doctor. It's a huge problem because he told me he does not collect any copays, deductibles, coinsurance. He tells patients, come in, Mrs. Jones, come on in. Don't worry about paying anything. We'll bill your insurance, and whatever they pay, we'll accept. If they don't pay anything, don't worry about it. You don't have a balance. If they don't pay anything, don't worry. We'll just write it off. This doctor got caught. He had nothing to prove. He has to give back hundreds of thousands of dollars to Cigna. It's a big legal mess right now. Here's another doctor. Imagine getting this letter. Dear doctor, we contacted some of your patients, and it has come to our attention that you routinely waive all patient responsibility. Ouch, that hurts. Next, what's your policy on the Stark and anti-kickback laws? It's simple. Just read it. Have your staff read your policy on the Stark law. If you don't own another facility and you're referring patients, you don't have to worry about it, but let everybody read it and you move on. That's what policies are. You read it and you move on. Some of them you have to take action. Anti-kickback statute, yeah. If a lawyer approaches you and says, I'm going to refer patients to you, you got to give me $300 for every patient I send to you, that's a classic anti-kickback offense. Don't mess around. You want to learn more about anti-kickback, there's a good reference. There are certain safe harbors regarding, referrals. If you have, like in my practice, if I referred my chiropractic patient to my employee who happens to be a physical therapist or an acupuncturist, I could refer intra-office under the same tax ID without violating the anti-kickback statute. It's okay. So you need to know some of the laws here. I have another question for you. What's your policy on patient discounts? How much can you discount a patient? Let's say your normal fee for an exam is $100, and here comes a patient without insurance or has a huge deductible, and you want to give the patient a discount or offer the patient a discount. How much can you discount? 10%, 20%, 40%, 60%? What's the answer? Does anyone know? Well, it depends who you ask. I have certain things in writing, certain things I don't want to know, certain things I don't want to poke the bear. You've heard that term? But this is available. This is out in the public. This is an opinion from the federal government about prompt pay discounts or time of service discount. You may have heard that term, time of service discount. Patient, you want to pass on the administrative savings. You want to give them a discount. How much can you discount? Well, according to the federal government, about 15%. What about your cash patients? What about your non-Medicare patients? What about your Blue Cross Blue Shield patients? What about those patients? How much can you discount? Well, check with your state board. I have the information from about 35 states across the country, so if you're interested in, finding out what your state says, like Colorado is pretty liberal. They let you discount more than, other states. Some states don't allow you to discount at all. Some states don't, some state boards didn't give me an answer, so, we want to keep it simple. What's your policy on free care, free exams? A lot of doctors offer free exams, free x-rays, or I see ads come on in, normally $250, but now it's only $17. I know some doctors, they have contests in their office. I surprised one of my clients. I just walked into his office one day and I see a mountain bike hanging from the ceiling. I asked the doctor, what's with the mountain bike? He has a contest going. The patient that refers the most new patients this month is going to win that mountain bike. It's like $1,000 bike. Is that okay? Can you give away as an incentive, to bring in new patients? Can you give away a gift worth $1,000? Maybe, maybe not. Have you checked with anybody? If you're doing these things without checking anybody, boy, are you gambling. Listen, I'm not a gambler. You know, I don't, I'm a compliance officer. I love going to Vegas, but I don't gamble. I go to the shows, I go to the restaurants, I'm not a gambler. So are you gambling? If you don't know what you're doing, or you have a reasonable reason why you're doing what you're doing, you're gambling. And that's what I see a lot when I work with hundreds of doctors. I've been doing compliance training now for over 12 years. I've worked with thousands of staff members, probably thousands of doctors. I don't really have an exact number, but many doctors. Well, this is what we do. A patient comes in, we put them on a 60 visit care plan, and we just take off 20% here and 30% there. And, when we do a screening out, we just offer free exams, or where did you learn that? Well, my friend told me, or I heard it's okay, or I don't know, it seemed right. Careful. All of you listening to this, if you are doing things that you haven't checked with your state board, or a good quality certified coder, professional compliance officer, you're risking. It's just not worth it, in my opinion. So what's your policy on free services? Do you know? Have you checked? Can you give a free exam to a Blue Cross Blue Shield patient that you're in network with? Is that okay? Well, here, according to the OIG, the federal government, you can give away a gift of nominal value, $15 each time, 75 total for the year. I call it the $75 rule. Don't get in trouble like this guy. This is a chiropractor. He had to pay an $80,000 fine. He was giving away free electrical stim to his Medicare patients. Yeah, he got in big trouble. $80,000 fine. He's flagged. He's, on a certain list now. He's got a big strike against him. He gave free electrical stim to patients it says, to influence the patients to receive chiropractic adjustments. Ouch. That should get your attention. So here are some additional essentials. Name a compliance officer. Doctor, you don't have a trusted staff member that can handle it? Name yourself the compliance officer. Or how about co-compliance officers? I have a staff member. She's been with the doctor over 10 years, but she feels uncomfortable being named the compliance officer. So we put her on a compliance team. There's 3 people now. They're co-compliance officers. They work together. You need good patient forms if you're going to have a billing and coding policy manual. Staff members have to sign off on employee acknowledgement form, employee training logs. They're not difficult. They're simple. Put them together on your own, or find someone to help you. Have good, simple HIPAA forms. That's part of a good compliance billing and coding policy manual. A little bit about HIPAA. Now, HIPAA is about protecting patient health information. Billing and coding compliance, OIG compliance, that's what it is. It's all about billing and coding. So HIPAA is totally different. If you receive payment from insurance companies, you are considered a covered entity, which means you have to abide by HIPAA. We work with a lot of doctors. Believe it or not, we have tons of doctors that are giving us testimonials on our HIPAA program. You would think, oh boy, that's torture. Who enjoys that? We actually have clients. Let us know if you want to call or speak to any of our HIPAA clients to give you an excellent testimonial on our HIPAA program. Here's another question. What's your policy on business associates? Actually, do you even know what a business associate is? You should be aware of your business. If you're using a billing company, your billing company is considered a business associate. You work with a software company? Here's a list. A business associate is a person or organization that has access to your patient information that's not an employee. Do any of you have an outside company that takes care of your TENS machines and back braces? It's a business associate. You have a collection agency, transcription service, your software company. Who has access to your patient health information that's not an employee? I would bet a lot of money you all have at least one, maybe more than one. Do you upload your information to a cloud? Yeah, you need a business associate with that cloud storage company like Carbonite. We have a business associate with Carbonite. We have a HIPAA secure fax number. We have a business associate agreement with them. You could have a business associate with Google and other companies. Whoever has access to your patient information, keep a little list. Yeah, want a little surprise quiz? For HIPAA, reusing passwords across various systems and websites that store patient information, protected health information, is the best recommendation. True or false? That's false. PHI, I just mentioned it. PHI stands for potentially harmful information, private health implementation, protected health information, party happy individuals. Protected health information, PHI. You need to protect patients' PHI. The HIPAA regulations were broken down into two main rules: security and privacy, business associate and covered entity, administrative rule and technical rule, or none of the above. What do you think? It's security and privacy. If you receive a suspicious email directing you to a link, it is best to hover over the link first to see where the address leads. True or false? The answer is true. Oh, yeah, here's a picture of this is an email I received. This is an actual email that came into me. I have Netflix. I love Netflix, watch it all the time. So I get this email. Your account is on hold. Hello, we're having some problem with your current billing. We'll try again, but in the meantime, you need to update your payment. Update your account. Click on the link. You see, I hovered over the link. It takes me to some scammy website. Need help? You see all those links? Don't click on those links. That can cause a virus, that can cause a worm, that can cause malware to occur and shut your system down. And then what? Now you want to log in and you want to start your day and you want to start opening up your patient software to see who's coming in, and it's locked and you can't open it. And now your day is ruined. Be careful. Don't click on the links. Get trained. Have your staff trained. So if you want to learn more about HIPAA, again, if you want to try putting together a HIPAA policy and procedure manual on your own, this is a great start. You need to do a security risk assessment, so this is an excellent link. Try to do it on your own. If you can't do it on your own, contact us. We always recommend trying to do it on your own first. So HIPAA, get all the forms signed. You need to do a security risk assessment, create good policies and procedures. And just like with your billing and coding compliance program, same thing with HIPAA. Have staff trainings and log those trainings in a manual. All right, just a few closing comments. Yeah, I'd like to close with my 9-step action plan. Then we're going to get to questions and answers. Step 1, get proactive. Don't wait. I always say this. Don't wait for the oil light to flash on your dashboard. Get out of the car, open the hood, check the oil. It's the best way to prevent problems. Staff members, number 2, that's for you. Make sure all the patients, all your new patients, when they come in, they sign all your new patient forms. It's for your protection. Staff members, it's for your protection and the doctor's protection. Patients don't want to fill out forms. Sorry, it's required. Step 3, doctors, review all the paperwork before you walk into the room with the patient. Make sure you review it. Not only do I teach billing and coding, but now I teach risk management, I teach medical errors, I teach ethics at my seminars. So a lot of the stuff I teach now is malpractice prevention, risk management. Make sure the patient fills out all the forms. If you miss something on a form, you can get sued and be held liable. Number 4, review the policies from the insurance companies you bill the most. Understand the what and the why. Your CPT codes are what you're doing. Your diagnosis codes are why you're doing them. They have to combine. They have to match. There's a buddy system. I call it pairing, code pairing. For every diagnosis code, you have to have an associated proper compliant CPT code, or else you can give money back to insurance companies. Step 6, do a self-test on your SOAP notes. If you're not sure what I'm dealing with an acupuncturist right now. He told me his notes are really good. He got requested by an insurance company to see the notes, and he wasn't sure if he wanted to use me to review his notes because he thought his notes were really good. He sent them to me. They're horrible. They're terrible. He thinks they're good. They were horrible. Believe me, I have other situations where doctors think their notes stink and they're actually pretty good. But how do you know? How do you know? How do you know you're good at something unless you're tested? So do a test on your notes. Step 7, always keep learning how to improve your business and help more patients. Attend seminars, webinars on a regular basis. Go to at least one billing and coding seminar per year, preferably through your state association. Go to at least one of those per year. Step 8, that's what this was all about. This entire presentation was about step 8. Put together a simple billing and coding policy manual. What's your policy if you adjust full spine but you only bill 98940? What's your policy if you bill auto insurance is $250 a visit and then you're only charging your cash patients $50 for the same thing? What's your policy on that? What's your policy on deductibles and copays? And step 9, have regular meetings, especially with your staff that do your billing. If you use a billing company, do a spot check on them. Target Coding, by the way, now does billing. I don't know if anybody, clients listening to this, this is a new service we offer now. Target Coding does billing. We charge 7%. We send out the bills, obviously. That's the easy part, but it's the collections. Very good at collecting your money. Plus, we will review your documentation to make sure that it could support the codes you're billing. Do a spot check on your billing company. I'm working with 2 doctors right now being audited. The billing company was adding modifiers, upcoding, changing diagnosis codes. Doctor doesn't even know what's in his notes. It's terrible. All right, so just a few closing comments. Check with all carriers prior to submitting claims based on this information to make sure it's compliant. Can't guarantee that there's changes all the time, so we're not responsible for any changes that can occur. Check with all the plans you bill. Join your national and state professional associations. All right, so we're going to get to questions and answers now. Oh yeah, here's my contact information. We offer free consultations. If you just want to set aside 15 minutes to speak with me, about anything, about your practice, about your staff, about why you're not getting paid. You're seeing more patients, making less money. You're going to be dealing with American Specialty Health. Here, this is, one of the big things now is ASH. We have a program now. We'll show you how to get more visits out of ASH if that's what you're looking for, or more cash out of your ASH patients. So we have something called our ASH to Cash. We'll show you how to transition your ASH patients to cash patients. We'll show you how to get paid better and faster. We'll show you how to get more cash. If you aren't getting enough cash out of your ASH patients, we'll show you how to do that transition. Don't send in soap notes. You should not be sending in soap notes. If you're sending in soap notes, you're wasting a lot of time. This is a live training. You pick the date and time. This is not a webinar. Like, this is a webinar. We have hundreds of people listening to this webinar right now. This ASH training is just with your office, one-on-one. It's only $249. It's going back up to its normal fee of $399 very soon, so you might want to lock in your training. And here we call it the big 3, HIPAA, OIG, and OSHA. So do you get HIPAA headaches, OIG procrastination, OSHA indigestion? Just outsource all that. Most of you do not have the time, but you do have the money, $199, or you could prepay. It doesn't take a whole year. We just allow doctors to pay it out over a year. Our compliance program, it takes a couple of months and you're all set. HIPAA is the one that takes the longest because we have a whole bunch of videos you need to watch and take a little test, but we do all the heavy lifting. So we offer HIPAA compliance manuals, billing and coding compliance manuals. I have a book that I wrote on the best codes to maximize reimbursement. And I mentioned, pairing your CPD codes and your diagnosis codes. I look at it like food and wine. Pair your diagnosis codes like cervical radiculopathy with mechanical traction. That would be a beautiful pairing. I consider myself a coding sommelier. You may have heard that term. That's a sommelier is a wine and food pairing master and expert. You have to go through a lot of studying and testing to become a sommelier. I consider myself a coding sommelier. I'll show you how to pair your CPD codes and diagnosis codes. But yeah, they're in my book that I wrote. We also sell forms. I don't care if you have ChiroTouch, Eclipse, it doesn't matter. You could have the greatest software in the world. Everybody needs forms like ABN forms, letters of medical necessity. We had a doc that said, "Hey, I have a patient that needs a letter of medical necessity for those stand-up desks, those Vara desks." Yeah, put one together, gave it to my client. Client gave it to the patient. Patient got reimbursed by the company, or the insurance paid for it. I'm not sure, but it worked. So we have a whole bunch of letters of medical necessity, fight back letters. Anybody getting denied for 97140, we have a fight back letter. It works 80% of the time. It doesn't, these letters don't come with ChiroTouch or ACOM or Eclipse or any of the major software programs. We have sample soap notes. Look at our sample soap notes. We have them for PI, massage, wellness, simple adjustments, and complicated encounters. How about an exam form? Want a nice exam form? You want all of our HIPAA forms and our Medicare, example Medicare soap notes? It all comes in this nice package of forms. We email them to you. You ever have we mentioned it before, don't wait for the oil light to flash on your dashboard. Get out of the car, check the oil. Bring your soap notes in for a checkup. Bring them to us. We'll check them out. We have a 5-chart. We call it our comprehensive chart audit and fee schedule review. 5 charts will help you be proactive. Will probably help you find money you're leaving on the table. How do we know that? We've been doing this for over 10 years. You know that farmers insurance commercial? We know a thing or two because we've seen a thing or two. Same thing here. We know that we can find money that you're leaving on the table because we've been doing it. We've helped thousands of doctors over the last 12 years. We've had some doctors where we added one CPT code and added an extra $10,000 to the practice just by adding one CPT code. So we have our comprehensive chart audit and fee schedule review. We sell videos. Just buy a video just to, get the ball rolling. Go on our website. We have 11 videos that we sell on all different topics. We also offer memberships if you're interested. We have basic, silver, gold. How about an on-site? You ever have somebody come to your office and really dig in and scrub your claims and forms and interview your staff? Maybe it's time to have an on-site visit. Let us know. We do them. All right, so again, I want to thank everybody for attending. Here's our contact information. Let's go and see what questions have come in.